Have you felt exhausted in medicine? Like your practice is more like a treadmill than truly a calling? Is the charting weighing you down? Working well past your last patient of the day, charting at home, in the evenings and on weekends? The notes, paperwork, lab results, quality metrics, all the things, right? What if I told you there were some ways to make a change, to get more efficient, so you can finish work at work and have the margin to intentionally choose thoughts and actions consistent with your values and priorities? You can get my free guide with 10 tips for getting work done at work more efficiently. Get yours today at mededwell.com/efficiency. After that, if you know you want to take a deeper dive into your thoughts and clinical practice, check out MedEdWell Coaching with Dr. Stegink. Fight burnout and moral injury. Find fulfillment and create margin by examining your thoughts and actions to take that next step forward from where you are to where you want to be, aligning your actions with your priorities. To find out more and to book a consult, head over to mededwell.com/coaching. And now for the rest of today's episode. Welcome to the MedEdWell podcast, empowering physicians to get work done at work and then be able to reflect and choose what is important for both their life and medical practice. I'm your host, Dr. Ryan Stegink, general pediatrician and life coach for physicians. Thank you so much for joining me here on episode 40 of the MedEdWell podcast. I'm so thankful for all of you who have subscribed, shared these episodes, and just been taking next steps in your wellness. That's really why I wanted to start this in the first place, was to help others and to help myself as I process through these things and putting this together. In episode 39, we talked about batching, the fifth in our 6-part series about process improvement, optimization, workflows, and charting. And today we'll be kind of capping that off by talking about continuous learning, improvement, and changing processes. So thus far through my career in medicine, I've been involved in a number of quality improvement projects and process improvement initiatives. Some of them have included being a pediatrician, things about newborn follow-up appointments, about vaccination rates, about developmental screening. And those are a few that, for me, have been helpful and have moved things forward in my clinical practice and for that of my clinic. It's about seeing where you are, about implementing a change, observing, adjusting, and trying again. So these last 6 episodes, including today, address various areas of personal productivity in the clinical space. And there's always room for improvement, especially for me. But a lot of it comes down to having a growth mindset, being intentional, reflecting, and choosing what to focus on. So today, as we look at process changes, workflows, improvement, and iterative progress, we're going to examine it from 3 different perspectives. Personally, at a clinical team level, and at an organizational level, or maybe your entire practice. So we'll need to prioritize what can be implemented and getting stakeholder buy-in, but we'll look at these perspectives individually first. So first, personally, it's important to keep a list, whether paper or electronic. Some people would say in their brain, but that's sometimes a little bit leaky for me as I try to hold on to some of these things to consider that I might want to automate or improve how I deal with things. It could be preference lists, templates, how I batch things, when I sign my orders in the clinical workflows. I have some templated text for certain diagnoses that I'll put in the assessment and plan to put with those diagnoses. Sometimes as I'm working on them, I will put them in kind of the parking lot in the medical record where I have certain things that I'm working on, but they're not totally ready and that I may flesh out later. Maybe it's a new treatment option that I want to look up at the end of the day, and then I'll just make a quick note of. Again, it's about having a growth mindset and an openness to consider new things. So this is personally. But second, it's important to consider how to continue growing and improving at the clinical team level. So how do we hold on to some of those things? It can be helpful to get staff and team input, that input that maybe you keep on the board that you huddle around, or having a suggestion box, or encouraging people to submit ideas to clinical leadership that then can be considered by a wider group. It may just be asking someone, whether it's colleagues, staff, someone that you work with closely, say in the OR, what are your preferences? What's your style? How do you want to deal with these certain situations that come up in the processes? It can be having a debrief to say, hey, this situation happened. How is everyone doing? And how can we do things differently? That's been formalized in medical education and in a lot of specialties as part of the M&M, or morbidity and mortality reports, where you come together to consider, what can we learn from this situation? For me, I will do this most often by sitting down with my medical assistant and talking about, how did things go yesterday, as we consider how we want the next session to go. When we come up against those similar situations that might have been difficult. And I try to be open to input. It can be really easy to take things personally. And in my personal life, it's sometimes a challenge to receive that in a neutral way, to be able to consider that. But as I've been learning more through coach training, some of those things need to be considered. You are able to do it without judgment. So, still growing, but yeah, opportunities to improve and to change processes personally and clinical team level. But then third, there's also the organization level. Some of those systems issues, best practices, initiatives that may be outside of your organization, maybe within your organization. So it can be helpful to bring ideas to those who are leading those initiatives, or would have some influence if you were to start one. You could consider being on a committee, or helping to implement some of these things, and maybe figure out how you engage for a season, especially if you don't have protected time and it's going to be potential strain on your wellness. You have to make those decisions of what you're choosing to get involved in, but make sure that if you don't have protected time, that it is a big passion and you have the margin to do it. In all these areas, there can be both aspirational goals, things to push towards, and things to make happen. And some of them may be driven by pragmatism, what you can get done now. It may be about surveying the stakeholders, seeing what kind of buy-in you're able to get. But maybe you have to just keep that on your list of ideas and continue networking. It's all about taking that next step forward. So I want you to consider today, when you heard the words process improvement, what do you feel? Overwhelmed, frustrated, dismissive? Maybe take a moment and consider what your real priorities and goals, what they are, and how, if you focused on that, how you could align your thoughts about how you might need to grow. By keeping that end in mind, how might thinking about those actions you need to take help you feel energized, not overwhelmed, maybe inspired? Take a moment and reflect on these things. How these last 6 episodes, thinking about charting, about process improvements, about communication, batching, delegation, about all these things, and how you can take your next step forward. Thanks so much for listening today. Take a moment and share this episode with another colleague. Please subscribe to the podcast, leave us a review. If you're looking for a succinct overview of some of my top tips on charting and workflow optimizations, you can get your free guide at mededwell.com/efficiency. And if you want to go deeper, especially looking at how you're thinking about things and how that might be affecting how you show up, consider getting a consult at mededwell.com/coaching and see whether getting some coaching might really help you take your next step forward. Again, thanks so much for all you do, and have a great day. And now for our important disclaimer. Dr. Ryan Stegink is a practicing general pediatrician, but the MedEdWell podcast does not reflect the views, opinions, or belief of his employer nor his affiliated university. Additionally, the MedEdWell podcast is for educational and entertainment purposes only and should not be considered advice regarding financial, legal, student loan, medical, or any other specific topic. In such a case, you should seek consultation with a certified professional in that particular area. Again, thanks for joining us on the MedEdWell podcast, and have a great day.